Get started. Hello, everybody, and welcome to Phoenixville Library, where we are pleased to have our own resident physical therapist on the staff. Maria DeBeni is here tonight, offering her time to give us an update on physical therapy, an explanation of what it is, what its benefits are, and Maria, please take it away. Thank you.
So, hi, I'm Maria. I'm a physical therapist. I work in the library. And inspired by my mom, who is a physical therapist assistant, I got my doctorate of physical therapy from Albernia University. After going to Arcadia for undergrad, I went through the psychology track, but there were other options for chemistry, biology, for pre-physical therapy. But I chose psychology, so that's my background. I love this profession. It's very rewarding. I'm excited to share this with you. Obviously, disclaimer, not medical advice. Just have to say that. Obviously, results can vary between individuals, so I would never tell you one thing if I don't know all of your history. So, just general information to share. So basically, I want to talk about the training required to become a physical therapist, interventions and treatment approaches, as well as tips on a healthy lifestyle. So what is physical therapy? Obviously, when many people think of physical therapy, they think about exercises and stretches for treating injuries, but that's just one component. PTs care for patients with different types of concerns, strokes, brain injuries, balance issues, orthopedic problems, spinal cord injuries, so lots of different things that you could go to a PT for. So different things about physical therapy I thought might be cool to explore would be like different things people think and how they may not always be true. So one of the things the first one up there says 70% of consumers think a physician's referral is required, so a prescription. Now, a lot of the times, if you're going to outpatient physical therapy, you need to be referred by a doctor, but not everyone needs a referral. A lot of therapists have what's called a direct access license, and they can treat people for a certain number of days before they're required to get the script from the referral. So it's important to just, always be in the team with the doctor, but you can go to physical therapy if you need it without that, precipitating script. And PT is not always painful. A lot of people think that it's painful, you're doing all these hard exercises, but it's not meant to be painful. The like, no pain, no gain is not what we're here to do. We always want to treat you within a pain-free range of motion. We want to build you up to that stamina so that you can, live your life in a healthy way, but not cause you pain while you're doing it. And then I have another one on here, that's not on the slide, but a lot of the time people think that physical therapists will tell you to stop doing the activities you love, and that's not necessarily true. Like sometimes people, like with a running injury, like they'll think, oh, they're going to tell me to stop running. No, they're just going to help you along the way and like look at your impairments and help you do it in a safe manner to get you back to where you want to be. So education, I told you guys that I did 4+3, so that's the bachelor's and then 3 years of grad school, but there's also 3+3 programs, but you do need to have the bachelor's before you go to the DPT school, and then once you do your grad school, you have to pass an exam that's nationally licensed, and then you can decide to go through more education, which I did not do, but you can specialize. There's a ton of things to specialize in: acute care, cardiovascular, sports, electrophysiology, women's health, oncology, pediatrics, neurology, orthopedics, geriatrics, wound management. So there's lots of different specializations within physical therapy. And then as far as continuing ed, that one in the end there, every 2 years? Is it 2 years? I always forget. It's every 2 years we have to do a certain number of credits to maintain our license. So basically it's saying physical therapy is a lifelong education experience. You don't just stop learning once you graduate, you have to keep up with it. Other professional roles, so if you don't want to work in a clinic, you can be a consultant, you can be a teacher, you can be a researcher, you can be an entrepreneur, you can own your own clinic. That's not for me, but some people like that. So where do PTs work? Most concentrated in skilled nursing facilities and outpatient practices. That's where I got my start. I worked at a nursing home and I loved it there. Outpatient was not for me. I really didn't like the hours, but that's where a lot of PTs work. I actually work in a school, which many people might not know that physical therapists work in schools. So I work with kids that have individual IEPs, individualized education plans. And they have physical therapy as a service to help them access their educational environment. So what that looks like is helping them going up and down the stairs, getting on and off the floor, maybe if they have a wheelchair or a walker, helping them navigate through the school building on the playground. So I really love my job. I work with kids and it's amazing. The hours are so much better. I do also work in the summer. They have the extended school year, so you can choose whether or not you want to do that, have summers off, kind of like teachers, but you're not making any money for not working, but I really love it. As far as like the growth rate, employment of physical therapists is projected to grow by 14%, which is much faster than the average for all occupations. That means people want to become therapists. Some similar occupations: athletic trainer, which my husband was, audiologist, chiropractor, physiologist, nurse, occupational therapist. Occupational therapists I work with a lot in the school setting. They work on the handwriting aspect and some of those fine motor skills, coloring, cutting, that kind of stuff. Orthotists and prosthetists I also work with in the school setting, so kids that need, braces for walking, stuff like that I work with. PTAs, I worked with one over the summer. Sometimes they help with our caseloads. They just cannot evaluate students. That's really the biggest difference, I would say. But they, provide all the treatments and all the stuff that we do as physical therapists, physician assistant, that's some more rigorous schooling, education, recreational therapist, and speech language pathologist. And I work with a lot of SLPs at school too. They work on, how kids talk and in the school aspect as well. So that's like the related services team that I work with in the schools. Economic value: physical therapists provide a wide range of services to help people maximize quality of life. And what actually is being shown here in this graphic is kind of like the money that is projected to be saved when people go to PT instead of not getting PT, basically. So basically, if you have an injury and, you don't go to PT, it's going to cost a lot more than if you just go, economically. So it's a great job. It helps the economy as well. So why choose PT? It's ranked number 7 in the best healthcare jobs, which I did not know that, but I was reading a book about it and I saw that and I was like, that's kind of a cool thing. So I wanted to include that. And how they decide the ranking, it's over there. It talks about like wage potential, like work-life balance, like what people like about their job. That's how they decide the number of like where it ranks in best healthcare jobs. I just thought that was really cool. I did not previously know that until I was doing the research for this. All right, so how PT can get you back in motion. So this is where I kind of talk about interventions. So interventions are ways that we help you get back in motion. So remediation, it's basically improving your ability by enhancing your skills and reversing impairments, like fixing the root problem. So after a wrist injury, PT may help you gain strength and mobility. Adaptation, so alteration of the environment. So that would be like if you are in your house and you want to do something like with cooking and your pots are really high up and you can't reach them. So we would say like, oh, you should move this to a location that's easier for you. So changing your environment to adapt the task. Compensation, that would be like a workaround. So maybe a person with limited hand strength uses a gripper to open a jar. Task modifications, that would be like changing the rules of the game. So instead of working out for 30 minutes, we do 15 minutes and we talk about doing maybe a seated exercise instead of standing. So that's the task modification. And then environmental might be, maybe using a wheelchair ramp or some other kind of modification there. So not always is physical therapy just, you know, range of motion strength. We look at lots of different things. So these are the different like interventions you're going to see in the clinic as well. Physical therapy exercise, so maybe resistant bands, soft tissue massage, balance training, sit-to-stand transfers, ice and heat, which are kind of falling out of vogue, and gait training and education. So a lot of the time it's just like when we work on posture, it's mostly like making people more aware of themselves versus doing anything to change their strength. So, you know, if I remind you like, oh, don't forget, you know, roll your shoulders, like just, and then a couple times a day, if you think of that, then you're gonna have a better posture because throughout the day you're thinking of it more. So it's education, but it's also, you know, it's also, you gotta put the work in addition. Benefits. So the benefits of physical therapy are lots of benefits. I have a bunch of different things that I wanted to look at. Managing pain, maximizing mobility, avoiding and recovering from surgery, and injury prevention. So as far as managing pain, there's a lot of evidence that when patients use prescription opioids for 90 days, their risk of becoming long-term users increases, which is scary, you know, but it's real. So that's what patients are being prescribed. So we don't want that reliance on that pain medication when there's things that we can do, you know, to avoid that. And that's a really important thing. I really like meditation and mindfulness and all that stuff, but pain is real. Chronic pain is real, so it's really tough. Maximizing mobility and strength. So physical activity obviously helps to prevent certain diseases and chronic health conditions. Older adults that are physically active, they have a lower risk of cardiovascular disease, blood pressure disorders, high blood pressure, type 2 diabetes, high cholesterol, obesity, cancers, dementia, depression. So exercise is good for your body, and it helps your mental and emotional health. Physical therapy can also help you avoid and recover for surgery. It can significantly aid in recovery, aid you in recovering after surgery by restoring function and reducing rehabilitation time. So different therapies that you would think of in this category would be carpal tunnel or rotator cuff tears, osteoarthritis, so very common things that people get surgery from all the time. The next one I have on here is injury prevention. Through targeted exercises and education, physical therapy helps prevent future injuries by strengthening the body and improving balance. Preventing injuries often starts with understanding how we move and what puts stress on our bodies. And an effective way to reduce the risk is optimizing the way we interact with our environment. So that's kind of what I was talking about with ergonomics as well. Physical therapy can benefit people across their lifespan. From the first steps to later years, PTs help you stay strong, mobile, and ready for your future. So this is the guidelines for physical therapy, for physical activity. And so it's kind of broken down like age range. This is like what is being put out from the government as like what your activity level should be, and a lot of children are not getting what they need. They say their campaign is like play 60. It's 60 minutes a day. A lot of kids are not getting that activity level if they should, and it's not good. So I just think that also some of the issue is that people are not aware of these things. I think that a lot of the times people don't know that they should be moving that much. And it says on here for adults 150 minutes of moderate intensity aerobic activity. That's not just walking, that's like getting your heart rate up. So a lot of people are falling short from that. And I mean, I would say myself that I have a hard time getting that much activity in a week at moderate intensity. So that's really tough. But there are ways around it. And if you remember the benefits, then you're gonna be saying to yourself, okay, I can do this. So these are kind of some things that I use in the school to kind of get kids motivated. We do like minute to win it activities, balloon volleyball. We do Cosmic Kids Yoga, which the kids are obsessed with, and they follow along on a video. So there's so many different ways to get activity in. It doesn't just have to be, you know, lifting weights. It's important to kind of think outside the box. Dancing, walking, climbing the stairs, gardening, those are all ways to get your heart rate elevated and to get your exercise in. I also included on here, there's a resource on the American Council of Exercise. If you just go on their website, they have all of these videos. And it's free to use, and you can just kind of filter by your activity level if you're a beginner, and it shows you a video of like different ways to, you know, do different exercises for different parts of your body, and you can kind of filter through it. So there's all these resources. You know, if you can't think, like, if you're not sure what you should do, like, you can kind of go online and look at some reputable things on, you know, good ways to do things without getting hurt, basically, because they're kind of tips on how to do things correctly, if that makes sense. I don't know. But I really thought that was a cool resource, the American Council on Exercise, that website. So here's some different types of exercise. I wanted to just talk about each type. I talked about aerobic before that, 150 minutes. Sometimes referred to as endurance or cardio, aerobic physical activity involves moving your large muscles for extended periods of times, requiring the lungs to move more air to the heart and pump more blood and deliver it to your muscles. So it increases your breathing rate and your heart rate. So one way to test your exercise intensity is to try talking. If you're breathing hard but you can still have a conversation, it's probably moderate intensity, so that's what you're looking for. So, you know, if someone's saying to you moderate intensity, you're like, oh, what does that mean? It's probably just a little bit hard to breathe, but you can still do it. And vigorous intensity would be running or jogging. Like, it's probably hard for you to breathe. But I thought that was a good tip to include there. For balance, there's different ways to challenge your balance. I included a whole bunch of ones on here. I was kind of hoping that I could show you guys a few little balance exercises. He's laughing because earlier I told him to stand on one foot with his eyes closed. So one balance activity would be standing with your feet together. If you're doing a balance activity, you want to be near a wall or near a chair so you have something to hold on to. Or if your balance is really bad, then you might want someone with you. So standing feet together, that's one way. Then you can close your eyes, then you can turn your head. As you do each one of those things, it gets harder and harder. Think about when you're in the shower washing your hair and your eyes are closed and you're moving your head and it's so hard to balance. So that's just ways to progress that balance activity. Semi-tandem would be like one foot partially in front of the other. Tandem would be heel to toe. So that's another narrow base of support. See, I'm struggling to stand like that. And same thing, you can also close your eyes in each one of those positions or stand on something that, like a pillow or something that's unstable. Always near a wall, near something to hold on to. Single leg balance, standing on one foot. Heel raises with a narrow stance. I have my kids do this. They walk on a line and go up and down on their toes. This is really hard. And then I have down there the safety tips near the surface. Getting shorter, so say you can only stand for 1 second on one foot, that's fine. Just increase from there. You don't have to do it 10 seconds immediately to start. You just start gradually and then increase as you get better. And then if it's really bad, you might want someone there to help you out. Strength and flexibility. So this is where we talk about resistance training, working on different parts of your body. So the big like a lot of times people will go to physical therapy and they'll say like 2 sets of 10. A lot of times the reps change based on, you know, what the activity is or what muscle that you're working. And that's kind of why it's important to have a physical therapist, because they can say, oh, well, we're going to do 8 reps with a higher weight versus 15 reps with a lighter weight. So that can kind of help. They can kind of help you work through what's going to be best for the thing that you're trying to target. I need to take a drink of water. And then flexibility. It's important to work on flexibility after your muscles are warmed up, so you're not just going to stretch into your deepest stretch when you're, you know, first starting out. You want to, you know, if you're stretching, you're going to start dynamically. You're going to do some maybe walking lunges, do some like a dynamic stretching, and then at the end of your exercise, you know, after you're done all your strengthening, you might want to do some static stretching. So that's kind of another good reason for a physical therapist, because they can kind of help you figure out what you want to do and what order to do it. I included this little tip on here. It's important that you keep your muscles moving, because when you're sitting down, your calf muscles are not pumping the oxygen back to your heart. So a lot of times, that's why going on a walk is so good for you, because that muscle pump is pumping the oxygen back to your heart. And because when we're sitting down a lot, that doesn't happen. But another way to exercise when you're sitting down is to do calf raises. So if you're sitting down, you're just going up and down on your heels and toes, and that'll help that muscle pump as well. So like I said, you can always adapt it. Even if you're sitting down, you can still be exercising. All right. I also wanted to talk about fall prevention, because it's something I'm kind of passionate about from working at the nursing home. A lot of times people think that it's okay to just practice balance, but the important thing for reducing falls is to actually provide a high challenged balance. So like when I was working in the nursing home, you know, we were having people like reaching for a balloon and whatever. I mean, they were being guarded by a therapist, but it's not enough to just, you know, be doing standing on one foot. You actually have to be dynamically moving, and it has to have a significant, it can't just be an easy exercise. It actually has to be challenging for it to work and to be implemented, if that makes sense. I don't know how to explain that any better. So I have on here these 3 things. Reducing base of support, we talked about earlier, about like keeping your feet together, moving your center of gravity. That would be like reaching outside of your base of support. Reducing the need for upper limb support, so that would be like if I was holding onto a walker and I let go with one hand to reach for the balloon. So those are like different ways you can challenge your balance. Another thing I also really like to talk about when I talk about fall prevention is like removing a throw rub, or, you know, changing your environment. Like I said before, it's not always just what we're doing as far as exercising, it's also how we're looking at all the things in the person's life individually. And that's why it is. It's very individual to each person and unique. Posture and body mechanics is another one I look at a lot. So I have on here, obviously back problems are a big population of what we see in outpatient therapy. A lot of people are saying, oh, my back's hurting. Okay, well, a lot of times we're doing things that cause unnecessary wear and tear. We're doing things repetitively, and that's what's causing the pain. It's not just one, you know, incident that causes it. It's doing something over and over. So I kind of wanted to talk about that as well. So general principles for body mechanics, you know, is being upright when you're lifting something. Instead of, you know, reaching for something that's far away, you're going to bend to get as close to it as possible before you're picking it up. So that's kind of what's pictured in the lifting one. And as far as carrying, you're not going to carry it, you know, far away from you. You're going to carry it with your elbows bent and carry it close to you. So you're going to, use your legs to lift. You're gonna keep the load close to your body. You're not gonna twist. So a lot of times, you know, something might be over here. Instead of twisting your body to pick it up, you're gonna turn your feet, pick it up, and turn your feet again. Because that's gonna reduce the twisting strain on your back. So this one's just kind of how to sit at a desk. It's keeping your legs at 90-90, maybe your hips are a little bit lower than your knees, and then you want the screen to be at eye level. You don't want to be looking down. A lot of stress is being put on your neck when you're looking down, so you want things to be lifted up, whether that's putting something on a riser. What's shown here is like the curves on your back. So we have a natural curve right here and right here. That should be maintained when you're sitting. This picture is really funny, actually. And the one next to that is the back unsupported, so you want something, you know, on your back while you're sitting up. So that way you're not hunching forward, you're maintaining those correct spinal curves. And for vacuuming, I like that one because it talks about how a lot of times when I vacuum, I'm like this, and I'm like, wow, why does my back hurt? It's because I'm not walking with the vacuum. So I thought that was a really good example to include in there as well. Like if you're having a hard time, you can just adjust it, and that's just a simple little adjustment. And then afterwards, you're like, oh, this is not as hard as I thought it was because I'm using my whole body instead of just my arm. So this is another really important thing. This is something I feel like I run into all the time. Sometimes people feel like they're not getting good results because they're not adhering to the exercises. But if you include, like say you decide you want to work on balance, and every morning you brush your teeth and you decide, okay, I'm going to work on balance right after I brush my teeth. Adding that into your routine in a place where you already do something can kind of help you with that adherence because it's already part of your routine. So it's building a healthy habit. So you can say, after I brush my teeth, I'm going to stand on one foot. And that just is a good way. You don't have to do 30 minutes of activity all at once. Doing it over the day is just as healthy as, you know, doing a 30-minute workout, just interspersing it in your day. If you're going to do, like maybe you're going to watch a TV program and when a commercial comes on, you're going to do 10 heel raises. I mean, that's all as just as important as going for a 30-minute walk or even a 5-minute walk. So just building that healthy habit is really important. And an easy way to do that is by connecting it to something you already do in your daily life. So this is just kind of same thing. This is just talking about healthy lifestyle. The core elements of a healthy dietary life pattern are vegetables, fruits, grains, dairy, protein, and it's very hard to get all of those things in. So when you look at the MyPlate, it's a really good. It's another really good resource. It's a website you can go on, and they give you a lot of really good recipes and different things you can go on there to like decide like, okay, so maybe I don't really like apples, but I really like grapes. So like it'll give you like a list of things to go through, and then it'll talk about like what you can use to make out of what you like. So it's just a really good website. It's run by the government, and it's just a really good resource, so that's why I included it on there. Because I don't feel like most people would know to go on that website to look into recipes, but it's there as a resource. Hydration, you should drink a lot of water because when you're exercising, you need water because we're sweating. So the tip for healthy hydration is 8 8-ounce glasses of water a day. I know for sure I don't get that, but it's based on your body weight, and yeah. Obviously if you're exercising more, you need more water. So on a day that you're exercising more, you're going to drink more water. On a day that it's hot, you're going to drink more water. Meditation. I actually read this in a magazine the other day. I thought it was really a good tip to include. Similar to deep breathing, meditation taps into your parasympathetic nervous system, which is responsible for rest and digest, potentially lowering your heart rate and relaxing your blood vessels. Meditation before bed can be particularly beneficial as stress can interfere with sleep. Obviously, consistency is more important than length, so even 5 minutes a night of meditation is great. While experts generally recommend against using your phone in bed, many say that it's okay if you're playing a guided meditation. I use an app, but You don't have to. But if you just Google Headspace or any meditation and just hit play, it's really good for at night and winding down and stress. All right, questions?
What's the best way to shovel snow?
Oh, I love that one. It's the same thing. So obviously you're not going to want to lift the snow. You're going to want to push the snow with your whole body. And you want to take breaks. If it snows like 20 inches, you're going to have to go out there multiple times. You're not going to want to do what my mom does and shovel her whole driveway.
Now wait a minute.
She has a really big driveway, I'm just saying that. She has a huge driveway.
So years ago, I'm sorry.
No, you go.
Okay, so years ago, I had like shooting pains in my shoulder.
Yeah.
At night, I'd wake up, I'd be like excruciating pain. So what I think the cause was, I had a pocketbook that I always had on my shoulder.
That's very common.
So I stopped it. So I bought a pocketbook that I had to hold, you know, like
Yeah.
something we have to hold it, you know?
Yeah.
Well, my shoulder pain is back. And I think,
Same arm as it
yeah,
was
I think because I lay on my side, I lay on that side. So I'm trying to lay on the other side. And today, it hurts now, but it hurt earlier, and I lifted like 8-pound weights. I had like a set of exercises I do, and I actually felt better after I lifted the weights, which I thought was weird.
because you got the blood moving in there. A lot of times shooting pain is related to nerves. So I don't know if you were talking about that, like was it tingling and stuff like that?
No, just like
Oh, okay.
very painful.
Well, that's good.
Yeah.
Because sometimes that would be like a little bit different. But
Yeah.
when you move your muscles, obviously the blood's flowing and it's helping with healing.
Oh,
Right?
okay.
But you don't want to overdo it.
Right.
So you
Right.
kind of just want to stay within that pain-free range of motion.
Because I noticed like years ago I sprained my ankle, and I noticed the more I walked on it, the better it felt.
A lot of time, so that's why I was saying earlier that like ice and heat are kind of falling out of vogue, because what's happening is we're putting ice on something and we're immobilizing and we're not moving it, and then you're not getting that early mobility. So like they actually find like even with professional athletes, they like put them back into that training kind of, obviously it's gradual and they can tolerate more because they're professional athletes, so they start at a higher level, but you know that early mobility is key for that healing. It kind of brings all that, the healing stuff to the area when you're doing that mobility, and that kind of fights that issue that's in that area.
So is there shoulder exercises you would suggest?
Definitely. I mean, but the problem is, I wouldn't suggest specific ones for you without evaluating you, because I wouldn't know. So one of the things that we do when we're managing a shoulder is we look at your range of motion. We see, can you raise both arms the same height? If one is going higher than the other, okay, maybe that's something that you need to work on. So then we would do a manual muscle test, and we would say, okay, can you lift your arm to here, and then don't let me push it down? And then can you do the same thing on the other side? Is that one weaker than that one? And we would say, okay. Then we would look at all the different ways you can move your shoulder, whether it's flexion, abduction, rotation, and we would test the strength in all those areas and say, okay, it looks like there's a limit in your range of motion or your strength in this plane, so this is what we're gonna work on strengthening. So it's not necessarily like you would get an x-ray and you would see that there's a structural damage and then you would treat that problem. You would treat the impairment. You would say, okay, I'm having problems when I am holding my pocketbook, and then we would try to figure out what was causing that within the range of motion, the strength. And you know, we would look at your posture. We would say, okay, is she always sitting like this? Because when your humeral head is forward like this, then you're, you know, stretching out all these muscles here and compressing all these muscles. So do we need to stretch? Do we need to stretch here and strengthen back here? So it's a very multi-complex, you know, system that we look at when we're prescribing those exercises. You know, it wouldn't just be one size fits all. I wouldn't just say, oh, you should do 10 overhead lifts, because I don't know if that's going to help you. Does that make sense?
Yes.
Yeah.
Yes, mine was more concerned with the way the insurance handles things.
Oh,
And this
yeah.
is just from experience, and
This is a very
especially,
frustrating.
well, especially Medicare and
It's
people
very
with memory
frustrating.
problems. You know, my mom had dementia, and it was just so frustrating because number one, they can't, you know, they don't let them go consistently. It was sort of,
It's
oh,
like
we'll
when they
give you so many
plateau.
visits,
Correct.
and then we'll reevaluate. But it's
Correct.
unfair to them, because they really need
Correct.
to have everything working. And, you know, my mom, she was a trip though. I can remember being at one place, and I was visiting my mom, and the PT came in, and she's like, oh, do you mind if I, you know, do
Treat her,
physical therapy? You know, I'm like, hey, no problem. And it was funny, because she was telling me how, like, my mother would not participate. I mean, you know, her dementia was very advanced. And my mother was an athlete, so it wasn't like she couldn't.
Sure.
But when I was there, she did every darn thing. And I'm like, listen, you know, if you need me to be here, I'll be here.
Right.
Because I'd rather her get something out of it.
And she
But
was
I found
lucky
Medicare
because
to
she
be
had
very,
a supportive family.
Yeah.
But not everyone has
no,
that.
they don't.
And I
it's
will say
hard.
one important thing for people with dementia is to find something they're passionate about. Say they really like arranging flowers. Maybe you bring in some flowers and then they do that as their therapy activity. You know, they're bending over and they're picking it. So just being like very specific to, you know, getting them engaged. I mean, there are going to be times when you go in and they're going to say, get away from me, lady. You know?
Yeah.
And that's part of it, right?
And it just seemed like that was the norm unless I was there. It was kind of like she was trying to be good because I was there. You know,
yeah,
it was,
for
that was her
sure.
mentality.
Yeah.
And it was just, you know, and it was so frustrating that they would restrict the amount of visits, and then, well, we'll reevaluate and determine whether she's gonna have one. I'm like, this is like a kid going to kindergarten.
Yeah.
Oh, let's take summer break now, and we're gonna start again, you know, and I'm like,
So what happens
can't do
is
that.
they set out all these goals when they do the evaluation, and they say, okay, did they meet this goal or did they plateau? And if they're not making any progress, then the insurance will say, okay, well, you're not getting any visits because you're not making any progress.
right,
Thank you guys for coming.
Thank you.
thank you, this
Very
was
good.
wonderful, it was really
Very good,
cool.
thank you.
Yep. Thank you so much, Maria.
Yeah.